Good afternoon. I think we are in a very good mood for today's class. So today I am going to discuss a very important topics in the cardiology. It's not only in the cardiology, it's actually a very common problem, especially in our country like Bangladesh, India, Pakistan. The country have a very low socioeconomic status. So the problem is the rheumatic fever and chronic rheumatic heart disease. So I think many of you already know about the rheumatic fever. What is it actually? So rheumatic fever, though it seems to be an infective problem, but actually it is an inflammatory, non-suppurative, post-streptococcal infection. It usually commonly occurs, it affects the joints, skin, subcutaneous tissues, heart, and sometimes in the central nervous systems. So already I have mentioned that it is a non-suppurative, inflammatory, delayed reaction, usually due to the streptococcal infection. So it is a post-streptococcal inflammatory reaction or inflammatory problem or disease that usually affects the joint, heart, central nervous system, subcutaneous tissues and skins. And as it is a delayed reaction or immunologically mediated reaction, it is non-suppurative. So commonly occurs in the post-streptococcal infection. We know that post-streptococcal infection sometimes it affects the skin, it affects the throat, post-streptococcal pharyngitis in the throat. But rheumatic fever is actually closely related to the post-streptococcal pharyngitis. And you know that the skin infection by streptococcus, especially streptococcal beta hemolytic streptococcus, it usually affects the kidney, and commonly it produces the acute glomerulonephritis. But post-streptococcal throat infection or pharyngitis is usually related to the rheumatic fever. And if the acute rheumatic fever persists or inflammation occurs or recurrent inflammation occurs, and it may be chronic rheumatic problem, and chronic rheumatic problem usually it persists in the heart, which mostly involve the heart structure like endocardium and the valves of the heart. And how the rheumatic fever occurs? Already we have mentioned that it is an inflammatory reaction. And you know that there are many types of inflammatory reaction like early reaction, delayed reaction. But usually the acute rheumatic fever occurs 1 to 2 weeks after the post-streptococcal pharyngitis caused by the beta hemolytic streptococcus. And when it involves the joints, it causes the arthritis or arthralgia. When it involves the heart, it may cause the carditis, and carditis may be pericarditis, myocarditis and endocarditis. When it involves the skins, and it produces some subcutaneous reaction or subcutaneous nodules, and in the central nervous system, it produces some interesting and peculiar reaction and like abnormal movements of the body, choreotic movements of the body. If we come to the point, if we want now, I want to discuss about how common, that is the epidemiology of the rheumatic fever, and which age is usually mostly involved. So you know that the rheumatic fever usually occurs in the childhood, mostly 5 to 15 years of age. It is very uncommon, it's very rare below 3 years of age, and it's mostly commonly affected the female. That is, the female or girls are more affected than the boys. You know that it is more common in the low socioeconomic status because it spreads when people stay together. So commonly it spreads with the people like in the schools, in the camp, in the hostels, and this type of areas. And those where there is a very poor sanitation, poverty, overcrowding, there is a high incidence of the streptococcal pharyngitis and ultimately the rheumatic fever. So already etiopathogenesis, that is how the disease occurs. Already I have mentioned that this is a delayed immune reaction to infection with the group A beta hemolytic streptococcus, and most of the patients have a history of a throat infection, and after a latent period of 1 to 3 weeks, but commonly is 2 weeks, the antibody-mediated immunological reaction occur to the heart valves, joints, skin and the subcutaneous tissue. In the central nervous system, it mostly involves the basal ganglia. We know that the basal ganglia is mostly involved for our fine movements, the coordination of the movements. So ultimately, when the basal ganglia involved, there is an choreoform movement of the body or posture. So the other parts of the brain is less involved in the rheumatic fever. Now, the symptoms, as the infection is delayed, the symptoms occurs usually after 2 to 3 weeks. And why it actually delayed reaction? Because you know that already from our the pathology knowledge that the streptococcus have an protein, like it's called the M protein. This M protein is have a molecular mimicry, that is the similar type of proteins or structure or epitopes. It's involve the skin, have the structure in the skin joints and the central nervous system and the heart. That's why the antibody that is produced against these beta hemolytic streptococcus that cross-react with the proteins, similar type of M proteins or similar structure like M proteins or epitopes in the heart and the already mentioned structure, and produces immunological reaction and produce the diseases. Now, the clinical features, that is how the acute rheumatic fever presents to us or present to the doctors or in the hospitals. So the clinical features is, if we think like this, that when it involves the joint, what type of clinical features? If it involves the heart, what are the types of clinical features in the heart? So it's easy to memorize. So it's very usual when it involves the joint, it produces arthritis or arthralgia, that is the joint pain. And the peculiarity of the joint pain is that it is migratory polyarthritis. Actually, it is called the migratory polyarthritis. Why? Polyarthritis, as the multiple joint is involved, and migratory because when it involves a joint, partially recover, then it involves the other joint. So that is why it is called migratory. That is, one joint recover and another joint is involved. And this is very interesting. You know that similar type of polyarthritis occurs in few other conditions like SLE and other conditions. And in the heart, it produces the carditis, that is the pericarditis, myocarditis, and endocarditis. So in the pericarditis, the patient presented with the chest pain, and in the myocarditis and endocarditis, also patient presented with the chest pain and features of heart failure or palpitations and different type of cardiac symptoms. And in the skin, it produces the subcutaneous nodules. And special, there is a skin discoloration which is called the erythema marginatum. I will discuss it later on the features. And there are some non-specific symptoms like, you know, that every infection or inflammation have like anorexia, fatigue, weakness, malaise, like this. Now, I want to discuss about arthritis. Actually, what are the characteristics of arthritis? You know, arthritis means the inflammation of the joint. Arthritis can occur in many conditions. But what is the peculiarity? What are the peculiarities of arthritis in the rheumatic fever? So already I have mentioned that the arthritis of rheumatic fever is migratory and or fleeting. That is involve the different joints, and one joint is recovered, another joint is involved, and mostly it starts from the ankle or knee joints and like this, the elbow and the wrist, that is the large joints. And when the joints patient present with the joint pain or joint inflammation, you know that the pain, tenderness, swelling, and redness, that is all the features of an arthritis. It's similar to life of other arthritis, except that it is migratory. So one thing is that arthritis is the most common symptom of the rheumatic fever, because 80 to 90% of the patient of rheumatic fever have arthritis. So it's very common, and without arthritis, and the characteristic of arthritis already you know that what are the types is special characteristics. Now the carditis, rheumatic fever can involve all the structure of the heart, that is the pericarditis, myocarditis, and endocarditis. And the common presentation is the chest pain, palpitation, and when the valve structure involved, initially acute states, it produces the regurgitation, that is the leaking of the valve. The most common is the mitral regurgitation, and then is aortic regurgitation. Other valves can be involved also. But when the disease process is chronic or recurrent, it becomes specific, fibrotic, and due to inflammation, and ultimately it produces the narrowing. And we all know that the very common problem is mitral stenosis, which is most commonly caused by the rheumatic fever. So carditis is also an important feature of the rheumatic fever. 40 to 50% of the patients of the rheumatic fever have the associated carditis along with the arthritis or arthritis. So this is already we have discussed the arthritis and the cardiac problems. Next class, hopefully we will discuss the other presentation of the rheumatic fever and their characteristics. Thank you.